Hi everybody and welcome back to the channel. My name is Dr Adeola and today I'm going to be talking to Dr Adeola about breast cancer.
Hello everyone, I'm Adeola Adeyemi. I'm a doctor, I specialise in obstetrics and gynaecology, which is the care of pregnant women and of women's problems as well. I've been doing this for a few years now. I'm a member of the Royal College of Obstetricians and Gynaecologists, and it's my passion. And today I'll be talking to you, hopefully educating, sharing knowledge about breast cancer.
I feel like I'm hearing a lot more people recently getting diagnosed with breast cancer, and more so I'm hearing a lot more younger people being diagnosed with breast cancer, and I think that's quite scary. And this is an opportunity for myself equally, as well as everybody out there, to learn a bit more about the signs and symptoms of breast cancer. Also, to be maybe to a certain extent reassured that it's not the end of the world if and when it's found. But for today, I'm going to be asking Dr. Adeola some questions about breast cancer, and I hope that we'll all be able to learn from it and educate ourselves. And if by any way you feel that you can share this information, please share this video on your social media or wherever that you think people can learn and educate or encourage somebody who may be going through it at this time. Dr. D, what is breast cancer?
Okay, so taking a cue from its name, cancer signifies an abnormal growth or atypical growth, something that's not expected to be there. And in breast cancer, the breasts are made up of cells, tissue, fat, glands, lobules, without going into too much details. And it's when these cells that grow and replicate to make all these different parts of the organ start to do so abnormally.
Okay.
And so that's what cancer means. Really, it's an abnormal growth, something that ought not to be there.
Okay. So in breast cancer terms, there's an abnormal growth in our breast.
Exactly. Of the tissues in
of the
breast.
tissues. Okay. And how can we spot the symptoms and signs, or I think there might be an issue with my body? What are the signs and symptoms for us to look out for?
Okay, that's a good question. Breast cancer is one of the commonest cancers in the UK. According to the NHS website, about 1 in 8 women will be diagnosed with breast cancer in their lifetime.
1 in 8 women.
1 in 8 women. So wow. That's quite a lot to think about. Every year there's about 55,000 women diagnosed, and about 1% of those are men. Let's not forget that men have breasts too.
You see,
they can be affected by breast cancer.
I was going to ask you that. I think your natural mindset think women have breasts, but actually no, both the male and female species, we both have breasts, but they obviously grow differently. Hormones, women grow, men. Well, actually no, because some men's breasts with their hormones do grow.
Yeah, some men do have sizable breasts. It's not always normal, and sometimes it can be an indication of underlying disease. So
could that be an underlying breast cancer or just any other type of disease?
So other diseases that affect breast growth. So just without going into too much detail, because when girls hit puberty, that's when they start to make the hormones that simulate breast growth, estrogen. Okay, and in certain men who have high exposure to these hormones, either because they're overweight, because you can store it in the fat as well, or because they have liver disease, they can have larger breasts as well. So sometimes large breasts in men might be normal, might be a normal variant, and sometimes might be an indication of underlying disease.
But it's better to get it checked out.
Better to get it checked.
So 1 in 8 women will be diagnosed with breast cancer. Okay, so how can I help that statistic and look out for signs and symptoms of it?
Okay. So it is important to know your breasts. Okay. That is the key message, really, that the NHS, Cancer Research UK, Breast Care UK trying to get out there to people, to know what is normal for you. Because then when you know what your normal is, then you can tell what is abnormal. So it starts with really examining your own breast, so a self-examination. There's no recommendation as to how often to do this, but at least once a month is a good place to start, and you can do it, as part of your morning routine as you're getting ready for work, in the shower, when you have some privacy, or when you have some downtime. And it's really just feeling the breasts. So stand in front of the mirror. You can usually do them arms down, but also do them arms up as well, so you can see the glands on the side. Okay. So stand in front, look at them first of all. Look at the size. Are they roughly the same? They're not always exactly the same size. And notice the contours of it as well. Does it look symmetrical? Okay, does one side look a bit bumpy compared to the other side that wasn't there before? So have a look at it. And then the other thing is to have a feel. So when you're feeling, you feel around, because you have lymph nodes, which are glands sort of like drain through the breasts as well. So you feel those, and you feel also underneath the armpits, because the lymph nodes, the breast gland curves underneath the armpit there, and you have lymph nodes there as well. So just feel if there's any lumps, bumps or swelling.
Okay, I'm so tempted to just
start feeling.
And I'm thinking, should I do it now?
To start feeling. I think I also intuitively, as I'm explaining it, you start doing it as well. So you're feeling if there's any lumps, bumps, changes in the skin. I've actually got some props here that I was going to. So when you have them, so you feel around them. Feel if there's any bumps, any sizable lumps or things that you can feel. Some people do have lumpy breasts, and the consistency of your breast can change with your periods. If you're breastfeeding or pregnant as well, pregnant women can have a bit more tender, sore breasts. During periods, it can be a bit lumpier as well. So feel during your cycle and after as well, so you can tell if it's a consistent difference. And some women generally have more dense breast tissue, which can feel a bit more lumpy. Okay, so just pay attention to that. If there is a significant change, that's something to make your doctor aware of. Sometimes people say to have a systematic approach, so feel in either a clockwise manner or an anti-clockwise manner, but always just so that you do the whole side. Okay, so feel everything, and then check to see if there's any abnormal discharge from the nipple. Okay, so any offensive liquid or any blood is usually a red flag to inform the doctors about. Now look at the nipple as well. An inverted nipple, because I'm trying to find a prop to demonstrate that. Can you see that? So this bit, the pith, is almost drawn inwards. In the rest, it should be it's turned inwards. So that's what an inverted nipple describes. Turning inwards, it's an abnormal side. It might be that the tissues inside are tethering, sticking onto something, which is what's drawing, pulling the nipple in. So if you notice any rash or redness around the areola, so where the nipple is, in that dark area as well. And then there's something called peau d'orange, which is orange skin. So if the tissues are tight and almost you can see pores,
all those dots,
exactly like that, it's called an orange peel, orange skin type appearance as well. That might be an indicative of underlying problem as well. Okay. So we're looking, we're feeling, we're touching. Okay.
At this point, you've not mentioned any pain. So is pain a symptom?
So if you have a new pain that's just developed that you don't normally have, alert your doctor to it. Pain is not usually a symptom of breast cancer, but also something that sometimes needs looking at, especially if it's sudden onset, new, and associated with any other of these symptoms that we've talked about.
So we're talking about lumps. Does a lump in the breast area always mean this could be cancer? No. So if I do find something, a lump, does it always mean this is cancer?
No. And this is what I don't want. So if you go ahead and do the self-examination now, when you feel a lump or a bump somewhere, I don't want you to panic. There are lots of other benign pathology or benign problems that could present with lumps in the breast. Just always important that if you do feel one, that it is tested, so that you see your GP, you see your doctor to get testing, so that your mind can be put at rest. Over 50 in the UK anyway, there is a universal breast screening program. So most women will get an invitation from their 50th birthday or 6 months before to have a mammogram, which is an X-ray of the breast tissue, and that's how some breast cancers are picked up.
Why is it done at 50?
So because traditionally breast cancer was thought to be a disease of older women.
Traditionally.
So the prevalence was in women over that age, but now we're seeing more of it in younger women as well, which is why it's important to be breast aware, because if no one invites you for screening, you at least need to check yourself to see if there's anything you need to notify your doctor of. Because then if you pick up anything abnormal, your doctor can refer you onwards to a breast specialist, and they can conduct more tests and investigations, because that's the other way in which breast cancer is picked up. So it's through the screening program, and it's through people referring themselves or being discovered accidentally, or the other way is people who have familial breast cancers, which is something we'll come on to later.
Okay. So just briefly, what are the stages of cancer?
Okay, so staging is how the clinicians or specialists describe the site and size and the nature of the breast, so the abnormality, the abnormal cells, how far it has spread as well. So there's staging and there's grading, but without going into too much of the detail, you can find all the information I'm talking about, by the way, on the nhs.uk website if you put in breast cancer. So stage 1 and 2 are the early stages where the cancer, the growth, is of a smaller size and is not as invasive, it hasn't spread to the surrounding tissue. So stage 1 is limited to the affected breast and not affecting the other breast or tissue. In stage 2, it may have affected the tissue on the other side, but it's still not spread beyond the breast tissue. In stage 3, then the lymph nodes, remember the glands I talked about draining from the breast, may be affected either on one side or on both sides, but still there's no spread to the underlying tissue, so the muscles and the organs within the chest area. And in stage 4, it means there's spread. Stage 3 and 4 are the more complex stages, and survival with stage 1 and 2 is good. I mean, 1 year, 5-year survival rates in the orders of 90%. So 90% of women diagnosed with stage 1 and 2 at 1 to 5 years will still be alive. In stage 3 and 4, not as good as those. Still good in the UK because we have detection, treatment, there's a lot of support as well. There's a lot of encouragement to reverse lifestyle habits, but those are the stages that are more serious and can be more life-limiting in women who have this diagnosed as well. Now, the other thing to remember is staging is also important in helping the surgeons or the specialists, the breast specialists or oncologists, to plan treatment as well. Because if it's limited to one breast, then there's the option of surgery to remove either the lump just in that breast, if it's very localized, or the whole breast. But then if it's spread, then whether there's chemotherapy or radiotherapy needed. But then if it spreads across the whole body, then there's chemotherapy and other therapies to try and control the disease, try and limit it rather than to cure it.
So that was actually my next question. My next question was, what are the types of treatments available? And from experience, well, I say experience, from someone that I know, when she was diagnosed with cancer, breast cancer, the first thing she said at the surgery, in fact, she got diagnosed on the day and she hadn't even gone home to let the information settle and talk to her family. And instantly she said, cut off my breast, cut it off. She said, I just want it removed. And even the doctors were like, okay, let's talk through the options and the treatment options, but she was adamant that she just wanted it off. Is that a good first option to decide to remove breast, or are there treatment levels according to the stage, I'm assuming?
I think yes. I think a cancer diagnosis is a very hard one for anyone to take. And if I think the thinking is that it's something that is in a part of the body, then obviously our instincts say, well, remove that thing, take that danger away from me. But obviously the treatment is dependent on what type of cancer it is, what stage and what grade it is as well. So out surgery in very limited, localized, focused early stage breast cancer can be an option. And that option can be backed by chemotherapy or radiotherapy as well, just as extra treatment to make sure that the cells are completely eliminated. I think it will always be dependent on what the woman's situation is, what her diagnosis is, what the stage is, what her clinicians and those looking after her or him. Let's not forget advice.
I know, we're very quick to say her all the time.
Or him, what they advise. So everyone's situation is almost individualized to them and what their diagnosis is. So sometimes it can feel like just taking away the breasts, But we have to remember it's a large part of someone's personality, femininity, maybe masculinity as well, or how people perceive themselves. Which is why sometimes surgery also takes into account reconstructing the breast. If it's removed, or prosthetics. or things just to make people not
a bit
feel
more
exactly
back to
how
normal.
they were.
Yeah.
Exactly. Not exactly. It won't be, but at least to try and take away as much of the disruption
Yeah.
as possible.
The radiotherapy, the chemotherapy, I've heard, and people say that it can, for a harsher word, it ends up being a killer as well. So some people tend to not want to opt for chemotherapy. Does that happen?
So chemotherapy is giving anti-cancer type treatment. Some of the medications can be quite strong, very potent, and they come with side effects that are not very pleasant.
Okay.
So people note the typical hair falling off, nausea, the weight loss, the lack of energy. So having to go through all of that, already people have a very, severe illness, then having to go through treatment that almost makes you feel even worse.
Yeah.
Can be quite difficult.
Okay.
To put it lightly.
Yeah.
So that's why. So it is treatment and it works, and it is offered sometimes as a first line and sometimes as adjuvant, i.e. in addition. So once some people have surgery, then they have chemotherapy to really finish off those cells or to reduce them to a bare minimum.
Okay. Remission. What does remission mean?
So remission is when the disease is reduced to the barest minimum.
Okay.
So it doesn't mean the cells are completely gone. There might still be some abnormal cells, but not enough to warrant treatment, or when someone is completely cured. Okay.
So that word, so I see it a lot, and you see it on, social media and pictures, and it says, "I am cancer free." Well, the chemo treatment has worked. And they've now been told lumps gone and everything is fine. I am now cancer free. And then I see people saying I'm in remission of 3 years, 5 years. So I guess that means from when you've been told you're cancer free and you've been, should I say, living without it?
Yeah, exactly. So living without having to have active treatment for this disease. So as I said, it's reduced to a bare minimum. And people with very localized disease will have surgery and they've cleared all the cells. Then they can say they're cancer free, they're cured.
Okay.
But I think there's always that worry that are people true? Is the cancer truly? Because there's always, obviously, people think about the risk of recurrence.
Yes, yeah.
So while the goal is to achieve remission, i.e. suppression of the disease to the barest minimum or completely, or achieving a cure, which is completely eliminating disease, I think with remission, the thinking is always there is a possibility of relapse.
When you're told you're cancer free, do you stop all medications?
So people don't have to have chemotherapy, radiotherapy, the active treatment. Some people have hormonal treatments, which is something I haven't gone into as well. There are other types of therapies that can be used. But at that point, they're not on active treatment anymore. They will still continue to have surveillance. So they'll continue to have appointments with the doctor, follow-up, examinations to look for any new cancers as well. And some people might need to have further scans or imaging just to check regularly that there's no recurrence of the disease. So it doesn't mean they've completely stopped contacting the hospital anymore. They're just going to live
happily ever after. Yeah.
It always means they're free of the disease now, but they always keep in mind there's a possibility that it might return.
So if you've had breast cancer before, or you've had breast cancer and you're now cancer free, are you now more prone to getting other types of cancers because you've had a cancer already? Or
That's a good question. I think this is where I was going to talk about the familial cancer syndromes that I mentioned earlier. So some type of breast cancers. So in our bodies, there are cells that help. Remember I talked about cancer being an abnormal growth? Yeah. There's some, what shall I call them? We say gatekeeper mechanisms, to put them nicely, that make sure that these cells grow normally.
Okay.
In the way that they should.
Okay.
So when these gatekeepers become abnormal or they're faulty, then the cells grow abnormally. Okay. And one of these gatekeepers, I don't know if you've heard of BRCA, BRCA. So there's BRCA1 and BRCA2. So they're genes. There are also several other types of genes as well. And when these genes are faulty, it means they don't regulate the cells to grow normally as they should. So there's a risk that the cells can grow abnormally. because the gatekeepers aren't working. And that's what, in some families, when there's a recurrence of breast cancer, they might say, or they have an abnormal gene in that family. So they have these BRCA, BRCA, or there are several other types as well, genes that are supposed to be making sure the cells grow well and not working well. And so people can be screened for that. So if people have a strong family history of breast cancer, or they're worried that they're developing signs or symptoms of it, they can speak to their doctor and be referred for genetic testing in the NHS to see if they have these abnormal genes. Now, having the abnormal genes doesn't necessarily mean that people will develop breast cancer, but it means they're at a higher risk
of it.
And this is what Angelina Jolie had. She had the abnormal genes, hence why she elected to have the mastectomies.
To just completely
to eliminate the risk.
Yep.
And the other thing to note about these BRCA genes is, in addition to predisposing to breast cancer, they can also predispose to ovarian cancer. So some cancers are linked. There's still a lot of research going on as to which cancer links which cancer and what links what. So that's why in some families when they have breast or ovarian cancer, they're referred for screening to eliminate whether there's these faulty genes in the family line.
In everything that we've discussed and how cancer, the signs and symptoms you can get of cancer, one of the things that I think is probably obvious is our lifestyle and how we look after ourselves to, in an ideal world, prevent illness, like breast cancer. What would you advise is a better way of living, food, exercise, to prevent, control, manage the chances of getting breast cancer or any cancer?
Okay, that's a good question. I think it's never wrong to have a healthy lifestyle, right? Because having a healthy lifestyle helps to reduce the risk of disease, but also, should you be unlucky enough, it also helps you to fight the disease, because it's always a good starting point to start from a healthy baseline rather than already starting from a depleted or ill, unwell body. So the importance of a healthy diet cannot be overemphasized.
It can only do you good.
Exactly, it can only do you good. And there's always the healthy eating plate that the NHS website has produced, recommending portions and things like that.
Sorry, Doc. In our culture, that plate looks like, we would call it
looks the other way around.
Are you trying to suffer me here? But
the other way
I
around.
think in the African or in the black culture, if our plate is not pleasing, then we're not full or we're not fed. And I think that is a generational psychological.
So unlearn.
But we've been like that. I've been like that for close to many years. It's a cycle that you need to try and,
less is more.
Less, no, we're not going to hear that. But yeah, you're right. I've seen that plate from the NHS, but you're like, okay.
Less is more. But yeah, eating your greens, your vegetables, drinking water, keeping hydrated. Then there's also the role of exercise.
Yes.
As well. And that is important in maintaining, I was going to talk about this, a body mass index, which is a BMI. And that is calculated by your weight in kilograms divided by your height in meters squared. So 20 to 25 is classified as normal weight.
Okay.
Under 20 is underweight.
Okay.
25 to 30 is overweight. And then 30 and over is obese. Okay. And there's morbidly obese, and then there's obviously life-threateningly very obese. But where we want to be realistically is between 20 and 25. That's not always easy to achieve, and it's easier said.
I'm going to calculate myself.
Easier said than done. But the nearer you are to that, to 20 to 25.
Okay, so the nearer you are
in that range, exactly,
so
the better, really. And how you do that is exercise, eating healthy, things like that. Okay. Then there are other things like avoiding smoking and limiting excessive alcohol intake as well. Okay. So those things help to reduce the risk. Now there are other things as well that people don't necessarily think about, because estrogen exposure, so breast cancer is actually more common in women who have, or women, let me say this, women who are at higher risk are those who have had a lifetime of unbroken estrogen exposure. And if you started your periods early and went into menopause late and didn't have any children, to break up that cycle of regular estrogen exposure, that can increase the risk. Breastfeeding helps to reduce the risk of breast cancer.
I've heard that.
So another incentive to do that as well. And then we talked about the familial cancer genes and getting testing and information about risk reduction. So things like that. Now things like the combined pill or HRT, because those are also additional hormones. The combined pill only very slightly increases the risk, but that risk goes back to normal level once you stop it.
Okay.
And by 10 years later, you are at the same risk as people who didn't take it.
Okay.
Okay. HRT also slightly increases the risk, but that is also reduced once you stop. Okay. And after a certain number of years as well, your risk goes back to baseline. Okay.
Dr. Adeola, for me, that has been extremely enlightening. I think you watch a lot of things on YouTube, on TV, and I think sometimes you hear so much information, and sometimes to an extent, too much information, you're like, oh, you get a bit overclouded and you get a bit panicked. But listening to you and hearing it broken down, simple enough for me to be able to understand it, and I'm hoping everybody else out there. Thank you, Dr. Adeola, for your time. Where can people find out further information? Because I mean, we could be here for hours, and I know you're a doctor and you can go deeper into the information, the terminologies. But where can people find out more information if they're worried or they just need the general knowledge about this? Where can we go?
Okay. So there is a lot of information out there. And as you said, we can keep going on and on about this. I think what's important is that you get accurate, correct information that is timely as well, so it's still relevant. So you can never go wrong with www.nhs.uk, which is the NHS website. If you type in breast cancer, it brings up all the information, all the things we've talked about today are on there. There's cancerresearchuk.org as well, and there's breastcancernow.org as well, and that's recommended by nhs.uk. And these have all the information about the symptoms, diagnosis, treatment, support, lifestyle, because it's an all-encompassing diagnosis as well. People have to think about life insurance, financial support, how it impacts the people they live with as well. So all that information is
in
out
fact,
there.
we didn't even go anywhere near that, and I know if we did go into that conversation,
That's a whole...
Because I've literally, as you've said that, 2 more questions have come in my head, but then that will take us down. And you just said life insurance, because you're right. When you get diagnosed, the first thing you now think is life is over, and or my life could be shortened than what I expected. So therefore, it's that planning that none of us want to do. It's that planning of the incasities then, but at the same time, you need to be realistic with life, realistic with your diagnosis. Obviously, we hope and pray that you don't get to that point, but there's an element of practicality you've got to take when you get that news. And you just mentioned life insurance, and that is part of the practicalities.
Yeah, I think, and that's the other thing is there are lots of charities out there. There's Macmillan that support people as well. There's lots of cancer support nurses. You can find all the information about this on the NHS website as well, because it can be quite a very difficult time, but there is support out there. There's information out there as well.
You're right, because not long ago I was watching TV as usual, and a lady came on and she was being interviewed, and she was from an organisation called Black Women Rising. Now, she has specifically put this organisation together for women of colour going through breast cancer. And I think one of the main reasons that they put this together was lots of information, so much is going on, you don't know how to control it, you don't know how to, to take it all in and manage and know what the next steps are. And I think that element of support is so important. So I think that Black Women Rising is there for that. And I think not only that, in the Afro-Caribbean community, or ethnic minority, should I say, they've particularly picked up that we don't talk about it. I think it's just one of those forbidden conversations in our cultures that we don't talk about. But
I think because people almost see death and sickness as taboo
cancer,
subjects.
dead.
Don't talk about it.
No, I think
I read somewhere that Black women are more likely to be diagnosed at a later stage.
And why would that be?
And I think this is part of the things that feed into is that people not having the awareness, not knowing, or even when they know, not having the information. Because we don't talk about it, or we don't read it, we don't want to know.
And I think
that's part of why we need to educate. This is why programs like this get the information out there, raise awareness. That people, it's not a taboo to talk about these things. It doesn't mean people will get it by talking about it, but we can raise awareness as a community.
Absolutely.
Get people informed, know that there's information, there's help, and there's support.
Absolutely.
Out there as well.
That's and that is the summary of this interview. And if you're watching this interview off the back of the Celebrate the King online concert, that's one of the reasons that we put this concert together this year, was to support breast cancer. We've done this concert now. This is our third year in doing it. And in the 2 previous years, we've supported sickle cell and we supported Mind last year. The first year was sickle cell, last year was Mind, this year is breast cancer. And I think it was for that particular reason of raising awareness that, for a looser word, it's okay if you're diagnosed with it because there's help. We are in a world, in a country, should I say, where help it's at our fingertips through your phone, through networks, Black Women Rising, the NHS, Macmillan. But we have to stamp that stigma of not talking. I can be sitting here and I could get diagnosed. It is what it is. It's okay. I know what I'd need to do next. But me keeping quiet and keeping in my shell, and I guess that's what happens. We brush so much under the carpet, and by the time you discuss it or go to reach out, you're at the later stage. And perhaps, if we'd spoken up earlier, perhaps, I'm talking in a world of perhaps now, but this program, this interview is about education, communication, talk, ask questions. I've always been taught by my parents, no question is a silly question. Yep. Just ask, reach out, and ask and speak to people.
Yep. And if you're unsure or in doubt, please speak to your doctor.
Yes.
Just call your GP, explain what the situation is. I know there's COVID, there's coronavirus, but they can listen to you, they can refer you appropriately, they can reassure you if that's the case. But please don't sit in silence, don't suffer in silence.
Absolutely. Dr. Z, thank you so much. You have been an instrument of great knowledge. And as I said in the beginning of this interview, please feel free to share this video. Yes, it's not your average 3 or 5 minute video, but I definitely think it's worth the watch for anybody that needs it and anyone that needs to be encouraged. Thank you for listening, and God bless. And thank you for watching, and God bless.
Thank you.